got to talk to the community from the Shree Swaminarayan, the Kuchi, yeah?
Kachi.
The Kachi community. And these are apparently the largest Asian community that we have in Kenya. And they have got this amazing facility here. First of all, the most beautiful temple that I've ever seen. And hello, I'm talking and you're swaying away. We'll take them to the temple. So we came here for prayers. They had lost one of their previous chairmen who is responsible for putting this entire complex together. It's got a school, it's got a hospital. They're coming up with a playground for our children to play, which is so important. And Baba has this vision of Baba Care. And I spoke to them and I said, I'd love to visit the hospital. I don't think a lot of people know about the hospital. And the thing that touched me is universal health care is about affordability. And what touched me about the hospital is that for 300 shillings, all right, so there's some people who basically have not gotten into the National Hospital Insurance Fund. But with 300 shillings, they told me you can come here, get seen, and get your medicine. And a lot of people are complaining that when they go to our public institutions, they don't find medicine. And if they don't have an NHIF card and they pay, the medicine becomes the biggest impediment. And we know that there's a lot of corruption there. Sometimes they don't have medicine, and it's because they have pharmacies that they're running across the road. So, we really have to deal with corruption. We have to accept that we have corruption in our country, and it's the biggest elephant in the room. Now, to provide universal healthcare, there's a lot of partnerships that are needed. So you've got the faith-based medical centers, and then you've got the public center, hospital facilities, and then you've also got the private sector. But overall, all of us have to check each other. I mean, if you look at the UK, even the richest of the rich will go to a public hospital, the NHS, because that's where the best doctors are, and that's where it's free, all right? And even if you're somebody from outside, if you get in there, you're getting the best treatment. So I am here today to basically expose this facility that has agreed to have a free medical camp. So if you're in Nairobi and you're watching and you've got a medical challenge, you're not feeling well, and you've been struggling with your health, today is the day to come for a free medical check. You'll get registered for free, so you won't have to pay the 300 shillings. You'll get your drugs, and if there's follow-up treatment, then I can negotiate with the hospital, which says that they have a foundation that actually treats people for free. But the thing is, universal healthcare can only be attained if we all get into the NHIF program, all right? And I'll also be addressing the issue of NHIF and not paying the various institutions that are registered and providing services, because they're actually strangling some of these institutions that they're not paying. So that's something that we'll also be following up. So I'm going to go through as a patient. I really needed dental works, but I've been so busy with life and life's happenings and challenges that I've not given myself time for a dental check. So today I'm actually going to have a dental checkup, right? I cracked a tooth the other day and I haven't had it checked, and thank God it didn't crack so deep. So I'm going to have a dental checkup. I need that brush and that clean so I can give you a good smile. So I'm going to start off with the registration desk. Tell me, my dear, the name Shree Swaminarayan Hospital.
Okay, Shree Swaminarayan Hospital. It's a god name. Shree is like someone you are respecting. So Shree Swaminarayan is a god name.
It's a god name.
Yes.
So tell me about this god. I know the Indians have got many deities, and I know Krishna, I know Lakshmi,
okay.
I know so there's so
Ram
many.
and
yes, Ram.
Okay. Swaminarayan is even under after you see Krishna, the Ram came, and then after the Ram, and then Swaminarayan came. So God is one.
Yes.
God is one. So it is a different incarnation or
so it's the reincarnation.
Yes.
So the first one was
Krishna, and then Ram, and then Swaminarayan.
He was the third.
Yes.
All right. So Ganesh would be
the, like, what do you say, God's son? Not really Swaminarayan. There is a God called Shiv's son.
Shiv's son.
Yes.
Okay, fantastic. I went to Indian schools.
Yes.
I mean, Ismaili schools, but I've had a lot of
okay,
friends.
we have in a, if you say Hindu, there are very many Hindu. Some they believe in Krishna, some believe in Ram, some believe in Swaminarayan, some believe in Ganesh, Hanuman. So they are all different how you believe it.
Well, I had a beautiful Indian friend called Ramila Shah. She passed on about 21 years ago, and she gave me Ganesh. So in my house I have Ganesh. I have religious tolerance because I think we are all children of God.
For Ganesh, what we usually do, you see, if anything you are doing new, you have to put it Ganesh first.
Yes.
After coming all other gods.
Yes, when I opened my business, she
Yeah.
brought Ganesh.
Yes, so
and she
Ganesh
did
is
some prayers for me.
Yes.
Yeah.
So Ganesh is the first person. Whenever you want to do something new, Ganesh is the first person.
You go for your blessings. So,
Yes.
I always say that you never ask for the religion that you're born and you never ask for your parents. All right. So if I was born in Saudi Arabia, I would most likely be Muslim. If I was born in India, I'd most likely be a Hindu of whatever sect that there is within the Hindu community. And you've got the Shahs, you've got the Patels,
Yes.
you've got the,
they are all Hindu, but
yes.
they believe in
different gods.
Yeah,
right.
but they are all in Hindu.
They're all Hindu.
Yes.
So even the Kuch is Kachi is Hindu.
Yeah, we are Hindu.
You're Hindu as well.
Yes.
Okay, so I believe in religious tolerance. I believe that God is love. Wherever you look for God, it's love. So whether you're a Christian, whether you're a Muslim, whether you're a Hindu, we all are children of God. And because of that, I respect all religions. So I've been to temples and I'm honored to have been to those temples. I've been to mosques and I'm honored to have been to the mosque. And I've been to various sects of Christianity and I respect and honor all of them. So we all have to realize that God is one. And when you are godly, then you know that God is love. So this is a mission hospital and I'm really, really looking forward to going through it. So I'm starting off with my registration
And
process.
one more thing.
Yes.
If the name is Shree Swaminarayan Hospital, people think that we only serve our community.
Yes.
But this hospital is open for everyone who comes.
All right. So did you hear that? First of all, tell us your name and what do you do.
My name is Bhavika. I have been here since the hospital started.
When did it start?
It was started in
2017.
2017. Yeah, November.
Right.
September.
Yes.
But physically we started in 2018 January.
Right.
Yeah, so since February I'm here. I was used to be a receptionist before. Now I do some other parts of accounts and everything.
Okay, so from 2017, this facility is open not just for the Swaminarayan community, but for all Nairobians. It is here waiting for you to be served. And there's so many facilities that are here. There's a beautiful, amazing school. There's, of course, the temple. And there's going to be a playground outside. And now we're here to focus on the hospital. And remember, hospital care in our country, whether mission-based, religious or faith-based, whether public or whether private, the whole idea is to have the best service, the most affordable service, and to be able to have the right diagnosis early enough so that you don't incur so much in medical expenses and you can obviously save lives. So I am going through registration. Good morning, my dear. How are you? Yes. So this is normally what you pay. You charge someone 300.
No, we check 300 for opening the file and the consultation.
300 shillings is to open the file and the consultation. So I'm not going to get on the free program today. I'm actually going to pay. Where's my money? I never have my money. I ask for money for my handbag. All right, so here I'll pay the reception. Okay, Muhammad, hold on to this money. So
Dental is 550 consultation.
okay,
Yeah.
no problem. So it's Esther, ESTHER, Passaris, PASSARIS, and my date of birth is 20th October 1964. I'm going to be 58 this year, 2 years to 60. Wow. 861 9088 Westlands. So I live in Westlands, but I'm here in Langata for a medical check, and we're offering a free medical camp. So if you're not feeling well, come here. We've put the link on our various social media platforms on how to get here, right? And just come here. They're all set up for you. The chairs are ready. Look at that. They're setting up the chairs. They're expecting you here, and you're not. Okay, I'm paying because I think I should. All right. So another Kenyan can get a free service today. But I want to go through the process and I want you to come here and be able to get your treatment and get your medicine, and you're not paying. Everybody that is supposed to pay their 300 shillings today to get the consultation. So it's 300 if you're having a regular consultation.
Yes.
Right? But if you're having a dental, it's 550.
Yes.
Okay, but
and
today,
for specialist,
specialist?
2,500.
For a specialist, it's 2,500.
Like any specialist, ortho,
Author?
physician, oncologist.
Right. And then you get your treatment within that money.
No, 2,500 is just a consultation.
Uh-huh.
and then medication and lab work is extra if you are needed.
Yeah, but today we were told that for the 300 we would get
Consultation.
and the medicine.
Yes.
Okay, so today for 300, look, you're getting an opportunity today to get treated. If your pockets are having a problem right now and you don't have the resources, this is your time to get treated. So please take advantage of this opportunity. I'm here because this is important. Health is wealth. Okay, so what else do you need to know? 701 71 00400 Nairobi 0794 500. No. Okay. Okay. So today you'll have quite a few people doing this, so that they move fast, right?
Yes.
So you're gonna do it through here.
No. We'll be have the camp is that side.
Yes.
This is for the hospital who is coming to visit the hospital right now.
Right. But then when they come to the camp,
It will be that side.
the doctors will be there.
Yes.
Okay, great. All right, pressure. Let's see how much pressure I'm under. Elections are in how many days? 25? My finger.
That is SPO2.
Okay. All right, this is what a lot of us, when we were going through the pandemic, were checking our oxygen levels, right? No talking.
Reception okay. Nurse ने माफी दे सकते हैं. Fresh में पहुंच जाए हो. Reception okay. Nurse ने बोला ये.
What? What does that mean? Uh-huh. 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 Can you repeat it? That means I'm stressed.
No, sometimes it happens.
Uh-huh.
Sometimes it's happening. I think maybe because you're in activity.
Oh yeah, I did a workout this morning. Could that be it?
Not really, because maybe you're participating right now in activity.
Uh-huh.
So it might be elevated, but it doesn't mean that.
Can you
you're
imagine you've
hypertensive.
raised my pressure trying to get you here for a medical camp? Okay. On my way out, we'll check it again.
Sure.
Right?
But it doesn't mean that you're hypertensive.
Okay.
Sometimes it's
I'm actually normally low blood pressure.
everything can be fine.
You see, it's good to have a checkup, right? So I just found out that my systolic pressure is slightly high. Not much, about 19, right? 19 over the normal, right? I'm normally low blood pressure, and then when Nairobians drive me up the ward, I get to normal. So, so one, and this is something that government officers have to learn and have to do. So I've got a card number now. So every time I come here, that's my card, I can retrieve my file. So you keep my historical data.
Yes.
Okay, so this is my file. No? Okay, so I keep this. I go in and pay. So since I want a dental check, I'll pay 550.
Yes.
All right.
This is the reception where you usually pay. Yeah. For everything.
Habari yako? Umekuja medical check? Uko na mzee hapa? Haya. Tunamtakia heri. Haya. Na uko na NHIF? Mzee ako na NHIF? Ako nayo? Hiyo ni mzuri. Updated.
Sawa.
I have to pay $550 because I want a dental check. I cracked a tooth and I haven't had a chance to see a dentist.
So I don't need to put your details in the system. So just click over the nothing.
Okay, great. So we will go outside and sit. See, they're still observing COVID protocols. So they sit and not sit. Beautiful reception. From 2017, huh?
Yes.
Okay, so they're entering me into the system as I wait to go and see the dentist, and then we can go around. So when your patients come,
Yes.
normally they would sit here,
Yes.
right?
Yes.
And let's just go out and see, giving them time to register me and see where the medical camp, when you come in today for the medical camp, they will come here and then they will go out there.
No, for medical camp, when they come in,
Uh-huh.
we just make them sit here,
Uh-huh.
and then
Uh-huh.
nurses will be sitting here for checking blood pressure,
Right.
random blood sugar, and any other vitals to be taken.
Right.
So after that,
Uh-huh.
the forms will go to the doctor.
Uh-huh.
Doctor will see what history do you have,
Uh-huh.
and then he will ask you what problems do you have. He will treat you according to that, and then he will give you take the medicine.
Right, so if you're on social media, if you're a community health volunteer and you know that there's somebody who's unwell and hasn't got the chance to see the doctor, hasn't got the money, hasn't got NHIF, hasn't got money to pay for medical, this whole setup here is for you today. Bring your patient here so that they can get treated and they can get tested and they can know where they stand in terms of their health. So the lady here is setting up.
She's a farm tech.
You're the pharmacist. Wow, farm technician. So these are all your dawas?
Yes.
Hoping that today you will give them out,
Yes, I'll take them.
right? To people who need them,
Yes.
right? That's fantastic. So if you've got a cough, because we're in that cold season, you might get your cough syrup here today for free. If you've got stomach pains or bugs, you might get treated. If you've got diarrhea, if you've got a problem and you've not had an opportunity to get treated, please come to the Swaminarayan, Shree Swaminarayan Hospital in Langata. The link is below on our page, and we want you to take advantage of this medical camp. We're so grateful to the community for allowing us to have a medical camp. Open your file today for free. You'll be in the system for free, and then next time you come, you can just pick up from there. Get your NHIF card so that you can get treated. In most of the public and mission, you accept NHIF here,
NHIF
right?
only for civil servant,
Uh-huh.
and for only national scheme, if you are admitted, you get bed charges rebate for 1,600.
Okay.
For civil servant, they give outpatient service, and for ordinary person, it's just inpatient service.
Inpatient.
Yeah.
All right. So you're getting an opportunity to get an outpatient service for free. I hope with Baba Care, and I know with Baba Care, you'll be able to also get outpatient for free within NHIF. The rich will be taxed a bit more, the poor will be subsidized, but we all need to get on the universal healthcare program of the government, right? And Baba Care is going to be free, but that means that if we want to sustain quality medical services, then the ones who can afford, let them pay for the services so that the ones who can't afford can get that free service, because we know that not everybody will probably get a job quickly enough and not everybody will have the income and ability to pay, so we've always got to carry our brothers and sisters and be their keepers. So this is fantastic. See, they're all set for you. Medicines are already getting out of their cartons waiting for you to come. Thank you, my dear. All right, so you see, first of all, we're grateful to such facilities. This investment was made by this community. This is the biggest facility that they have in the whole of Africa, right? My dear, so tell us about yourself. How long have you worked here? All right, because you see, such facilities, such investment, when you have peace and stability in a country, come because of the peace and stability that we have in our country. So we thank our government for that peace and stability. Please introduce yourself and tell us what you're hoping to do for our patients today.
Okay, my name is Ruth. I've been working at Shree Swaminarayan for 4 years now. I am in the pharmacy department and I'm hoping to get a great turnout today. We have a lot of hypertensive medications, diabetic medications, antibiotics, painkillers and analgesics, and even supplements. So anyone who has any condition and they feel they need a free service, free checkup, they are welcome today.
So tell me something. You talked about, you see, I broke a tooth recently. I was just having something, I was having a samosa, and then I thought it was a stone in the meat, and I realized it was my tooth that broke. So could I be calcium deficient?
You could be. So we have the supplements for that.
But I'd love to find out if I'm calcium deficient. How do I go about that?
You will first see the doctor
Uh-huh.
and then get some tests done, and then she'll be able to tell you what you need.
Okay, great. So I need to test whether I'm calcium deficient, my vitamins.
Yes.
Alright? So is there a blood test which will happen immediately?
Yes.
The answer will come out immediately?
Yes. We do it here. Almost all the blood work.
Uh-huh.
Maybe some we send it outside because we don't have some.
Nyinyi mnamtibiwa?
So
Sawa, Muhammad has got a chest. Muhammad, be one of our first patients to sit here.
So you-
Dr. Rina, utibiwe kifua, si ndio? Yeah. I'm sure, what do you do with HIV patients?
we don't really attend.
There is something in the HIV
We have to.
Okay, for those who've not had their COVID vaccines,
We do Monday to Thursday every day.
so today is a Thursday. Every day they give COVID vaccines. Some of you have not taken the COVID vaccine. I've had my 2 AstraZenecas and I've had my booster. I think I had Pfizer for my booster. And why did I take the COVID vaccine? Is because, first of all, I lost my father to COVID. He was vaccinated and he got COVID. All right, and he passed on because he had a lot of underlying issues, and I guess we have to accept the will of God. But the fact is, I got COVID after my vaccine, not once, twice. And I tell you that the first time I got COVID, I had only got 1 shot, and it was really bad. I got it really bad. The second time that I got COVID, it was after my booster shot. When I came from the Afri cities in Kisumu, I came back with COVID, and I tell you what, I was able to sail through without too many. I wasn't that ill. I mean, I stayed home, I quarantined, but I wasn't that ill. So I want you to understand that the vaccine, which your government is providing free of charge here as
Yes,
well.
free.
Free of charge, Monday to Thursday. Come here if you live around Langata, Kibra, Makadara, come here and get your COVID vaccine. It's free of charge. It gives you a fighting chance when you do contract the virus. And at the end of the day, right, we are in that period where we are crowding and we're not wearing masks, and of course the chances of getting it and building a herd immunity is there. But if you want to fight COVID, don't let this investment that the government has made on vaccines go to waste. Come and get vaccinated, and this is also a center that's giving you vaccinations. Okay, so we can carry on. I want to see if they've got my change and they're ready.
So you want to go see dentist first?
Yeah, I want to see the facilities, then I see the dentist.
Okay.
So, which I need? Huh? Return card. Okay. Oh, you give my receipt and my change. Okay, so let's go. Where we going? Telling us about the receipt. We'll start from here.
Eric, I think you go around with him.
Eric, okay, I want to. Okay. How many employees do you have?
They work usually on day shift. So maybe 20, 30, 35, 45.
45
per shift.
per shift. So tell me, how many beds do you have? Patients sleeping here?
We have ICU, 3 beds. Male and female ward, 5 beds. Maternity, we have 11 beds. 12 beds. And then we have 2 private rooms. And pediatric, we have 5 beds. And NBU as well.
Okay, so they've also got a theatre here.
Yeah, theatre.
Right?
We
And
do all the
they've got
surgery.
ICU. They do all the surgeries here as well.
Yeah.
Yes, fantastic. So do you affiliate with other hospitals in India? Where if you have a complicated case, then you can... No, just local.
Just local.
Yeah, just local.
Yes.
Because there's some really complicated cases. Okay, please.
Explain
This is
the
one.
hospital
Take me
facility.
through the hospital and then I end up with the dental.
You can stand here because of the light. My name is Eric. I'm a nurse. I work here at Shree Swaminarayan Hospital.
Okay, great.
I'll just take you around.
Great.
So first here we have triage 1.
Uh-huh.
Then if the patient needs something like a dressing or observation, we treat them here.
So listen, you're too far. So dressing and observations are here.
Yes.
All right.
And then this is the vaccination room.
This is the vaccination room for COVID or any vaccination.
Baby vaccination.
Any vaccination.
Yeah.
Men, women.
So this is baby
Baby vaccinations.
vaccination.
Okay. So if you have a baby, you come here. And are those vaccinations also free?
For government, we charge only service fee, and private you pay. But we are very reasonable compared to all other hospitals.
So what do you charge?
500 for service fee
Okay.
from the government.
All right. So these are civil services.
No. This.
Oh, you mean government?
Yeah. The vaccine for the baby, when baby is born,
Yes.
see, they have to get vaccinated, polio and all those.
Yes.
HPV, BCG and all that.
Yes.
We give it here.
All right. So when you give it here, you charge a service fee of 500.
Yes.
And the vaccines are free.
Yes.
And if they have come in, registered and paid the 300.
No, we don't charge for opening the file or giving the vaccine.
No.
Yeah, only if you are taking consultation from the doctor, that is the time we charge 300 consultation.
Okay.
Opening a file is free.
Okay. Opening a file is free. That's why I paid after because I'm going to see the dentist. All right.
And what we have here is a room for sample collection.
Okay.
If a patient needs a sample taken to the lab,
Blood.
maybe
Like-
urine or stool, this is where it is collected.
Okay. Fantastic. I will need to do my vitamin check.
So that
I
one,
want
That
to.
one will be done.
Yeah, I want to confirm that I have no.
you want to do it right now?
Yeah. I mean, oh, on my way back. On my way back. If somebody can be here, then I can do my blood. I want to do my
Is there?
vitamin. Is there?
Yeah.
So you can do it now.
Yes.
So I sit here.
Yes.
Okay. So I
Which blood?
I want to do vitamins, calcium. How are you, sweetie?
Good.
Yeah.
Yeah.
So I want to do vitamins.
Like
Because
which
I'm
one?
thinking calcium, just vitamins and minerals.
So like specific which one?
Calcium.
So you want to do only calcium?
Yeah, let me do calcium.
Then that will be 600.
Okay.
Yeah.
That's it. So I can do that.
Yes.
Yeah,
So just have a
just
seat. We'll call the lab technician. Faith.
Sabina.
Yes.
Faith. Calcium.
How are you?
My husband was busy, so he
Yes,
said,
I
I know you
know.
go.
Yes. Okay, so this is the wife of the champ, right? And you know, we're hoping that maybe I stop my calcium that really suffered. So I think, oh, right. And it wasn't something hard.
I think you should take because when we get menopause as well.
Yeah.
And the knees.
Yeah. So this is my good vein.
Yes.
So you can take it from
It's very nice.
You can see.
baby needles.
Yes.
So Sabina, get hold of the CHVs, get them out there to bring their patients.